we want to switch our minds now and start thinking about the physiology of pregnancy. And this is important clinically because understanding the physiology of pregnancy will understand us to know the importance of pregnancy in the development of the fetus. Definitely the importance of the maternal changes that occur during this process of pregnancy. And to begin with, pregnancy is the development of an offspring inside the mother's uterus. So to help us understand this, I've just sketched up the drawing, of course, the anatomy of the pregnancy. Of course, this is the pregnant woman, and as you can see there, that is the fetus. So this is the fetus. So this is the fetus, and as you can see, coming from the placenta, this bit here is the placenta. So this is the placenta, and this is the umbilical cord. This bit here is the uterus, the uterus, the place of home for the developing fetus and of course the baby. And as you can see, these are the female genitalia. This part is the vulva. So we have got the urethra. In women it's short, as you can see, and we have got the bladder, the urinary bladder. Urethra, of course. So that's a urethral opening. And of course, we have got the vagina. That's the vaginal orifice or the vagina opening. And as you can see, we have got the anus of the woman. So that's the anus. Now, physiological changes in women, all of these physiological changes are going to be regulated by hormones. And the process of physiological changes in pregnancy starts in the luteal phase of the menstrual cycle. As you can remember, the luteal phase is the third phase in the process of this menstruation cycle. And this is the phase during which the follicles have already matured into the corpus luteum, and the corpus luteum starts producing certain hormones such as progesterone and estrogen at some point. So it starts in the corpus luteum, the luteal phase. So the first physiological change that we are going to talk about in pregnancy is that of the endocrine changes. So we have one physiological change. Changes in endocrine. What happens in these changes in endocrine? So the first, in the luteal phase, at the development of pregnancy, the anterior lobe of the pituitary gland, the anterior lobe, is going to start producing a lot of hormones. And the most important thing to notice during this stage, there is going to be hypertrophy of the pituitary gland. That is, the pituitary gland will begin to enlarge and thereby starting producing a lot of hormones. And one of the hormones produced by the pituitary gland is estrogen. And what estrogen does is that estrogen will stimulate tissue growth. So for example, tissue growth of the breast, the uterus, and also the development of the fetus inside the uterus. That's the work of estrogen. That's why we term estrogen as the developing hormone. Point to note, estrogen is the developing hormone. It's going to stimulate maternal growth. The growth of the uterus is because of estrogen. The growth of the fetus inside the uterus is also because of estrogen. All the maternal changes during pregnancy, such as growth of the breast, all those things are due to estrogen circulating around in the body. And the next hormone that the pituitary gland, the anterior lobe, is going to produce is progesterone. And of course, point to notice is that the pituitary gland is not really the one which is producing these hormones, but it's going to stimulate certain organs in the body, certain body cells, to stimulate these hormones. So, for example, to make this clear, the pituitary gland is going to stimulate the ovaries, the cells of the ovaries, that is the corpus luteum. It's going to start producing estrogen at some extent. That is in lower amount. Also, it's going to stimulate the cells in the corpus luteum. Those are the luteal cells. They will produce progesterone. And what progesterone does is that progesterone is going to maintain this pregnancy. That's why we term progesterone as the maintaining hormone. But how does this maintain the pregnancy? We just hear people say, or maybe scientists say, that progesterone is going to maintain this pregnancy. Well, of course, it's simple. There's going to be, at the start of each pregnancy, there's going to be increased vascularization. That is a lot of blood vessels towards the uterus and the vulva, of course. But in this case, we're talking about the uterus. There's going to be increased vascularization. And also, as well as that, there's going to be increased blood flow to the uterus. And as such, because of the increased blood flow and increased vascularization, there's going to be an increase in muscle tone. And the muscles of this, the uterus, will become more vigorously. So in order to do that, in order to prevent that, because when the muscles become more vigorously, the muscles of the uterus, they are going to contract. And once they contract, they are going to eject the baby towards the cervix and then towards the vagina canal. And if it's preterm, then that we term as a premature death, premature birth. So that's going to be an abortion, really. We don't want that. But progesterone is going to soften the muscles of the myometrium. It's going to relax them together with a hormone called relaxing hormone. So progesterone is going to relax these muscles, and then the pregnancy will be maintained. The other hormone that is produced by the pituitary gland is the relaxing hormone. Take note that these hormones are not coming directly from the pituitary gland, but the pituitary gland is stimulating the luteal phases, the luteal cells of the corpus luteum to start producing these hormones. So also relaxing hormone is produced by the luteal cells in the corpus luteum. And relaxing hormone does the same as progesterone does. They work in combination in order to soften, to soothen, to calm the vigorously muscles of the myometrium so that pregnancy can be maintained. The other interesting hormone that is produced by the placenta is the, you remember, you know what it is? It's the placental lactogen. And this hormone is very important because it is the hormone that is going to change the metabolic rate in the mother. It's going to cause the insulin resistance to rise in the mother, and thereby I think this is important for us to understand. So I think I'll use a diagram to explain this in a little bit more details. So here we have the blood vessel of the mother. Of course, the red blood cells going through. So this is the blood vessel. So this is the blood vessel, and then we have the red blood cell going through one at a time, of course, red cell. And as well as that, we have tissues. So this is a tissue, and we remember that in each and every tissue there is what we call the insulin receptor cells. So the insulin receptor cells are going to allow glucose to go inside instead of remaining in the blood. But in this case, what the placental lactogen hormone does is that it's going to increase the insulin resistance. Hence, we are going to have insulin being resistance from entering the mother's body, and then it will remain in the blood. And that's good, because that remaining blood is going to go round about in the circulation, and then it will go even to the placenta via through which the baby feeds. And that is very good, because the fetus is going to use the glucose which was supposed to be in the mother's blood. And the other hormone to consider, the most important hormone, one of them, this is termed as also the hormone of pregnancy. That's a human chorionic gonadotrophic hormone, human chorionic HCGH. This hormone stands for human chorionic gonadotrophic hormone. And what this hormone does, it's going to increase, it's going to support the steroid production of hormones, and these hormones are estrogen, progesterone, and as well as relaxing hormone and human placental hormones. So that's about the endocrine changes. The next thing we want to talk about now is the changes in respiration. As we can see here, we already have the lung, probably either the left lung or the right lung, whatever, it doesn't matter. But one thing to notice is that we have the lung. So this is the lung. So this is the lung. Now, what are some of the changes that happen as a result of pregnancy? As the uterus is growing, as we can see, as the uterus is growing, it's going to be compressing the lungs. And once the lungs are being compressed, then we are going to be forced to breathe deeper. So the woman can have about some little bit of dyspnea. So there's going to be dyspnea. Dyspnea related to the lungs being compressed in excess, such that we are not able to breathe. And as a result, the mother will be having some breathing difficulties at some point. So that's good, because it's going to cause the mother to inhale even more oxygen and to exhale a lot of carbon dioxide, because the mother is supporting her life and the life of the fetus. So the fetus can't exhale its carbon dioxide. It's going to exhale via the placenta, and the mother will be able to get rid of that carbon dioxide. So the lungs are going to be compressed. And what happens when the lungs are compressed also, as well as that, is that the residual volume is going to decrease. The residual volume is going to decrease, and the tidal volume is going to increase. The residual volume being the amount of oxygen which is going to remain in the lungs. After a forceful expiration, the tidal volume is the total volume of all the air which is breathed in. So all these are the physiological changes in respiration. Now, as well as that, we also have the cardiovascular changes. So we have the cardiovascular changes. Now, in cardiovascular changes, we expect the blood to go high. So there's going to be an increase in blood. The red blood cell number is going to increase, and as a result, there's going to be an increase in the intravascular compartment. And what happens when we have the increase in the intravascular compartment is that we are going to have a large amount of blood going to the heart. And when we have a large amount of blood going to the heart, then that simply means we are going to have an increased stroke volume. Stroke volume being the amount of blood pumped out by one ventricle per minute. And then when we have the high amount of stroke volume, then that simply means we are going to have the large amount of cardiac output. Because cardiac output equals heart rate times stroke volume. The heart rate being the rate at which the heart is pumped as a result of this increased intravascular compartment. And you might expect the blood to increase in pregnant women because of the increased intravascular compartment, but that's not the case unless if we are considering the condition known as preeclampsia. But in this case, the blood volume, the BP, the blood pressure, is going to go down. And the reason why the blood pressure is going to go down is because of the hormone progesterone. Because what progesterone does is that it's going to cause the blood vessels in the maternal pregnancy to start to dilate. And when these blood vessels dilate, that's good because they are going to allow for accommodation in the increased amount of intravascular compartment to even go to the placenta, and that's good because the baby will have its nutrients, its oxygen, and its blood cells, and as well as that, it's going to have a lot of immunoglobulins as a result of the dilated blood vessels due to the effect of progesterone, sorry. So the blood pressure is going to reduce, and when the blood pressure increases in maternal pregnancy, that simply means we're going to come about to this kind of condition, that's preeclampsia, one of the most important conditions to consider in pregnancy, raised blood pressure in pregnancy. So very, very important to notice that the blood in maternity reduces as a result of progesterone, because it's going to cause vasodilation, and that will allow for more blood to go through the uterine and then through the placenta so that the baby can be nourished with these nutrients coming in from the mother. And the other thing to consider in the cardiovascular changes in this the maternity is the inferior vena cava. So for example, there is a condition known as supine, that's a posterior supine hypotension syndrome. Now supine, that's supposed to be posterior, so it's supine hypotensive or hypotension syndrome is as a result of the inferior vena cava being compressed as a result of the mother lying in the supine position. So very, very important that we do not let these pregnant women to lie in the supine positions. At least if that was to happen, then at least we are supposed to support that mother with a pillow. Because if the woman lies in supine position, then that simply means the growing uterus is going to compress on the inferior vena cava, and when the inferior vena cava is compressed, then that's going to reduce the blood supply, the blood which is coming from the lower extremities towards the heart is going to be disturbed, it's going to be compressed, and as a result, we are going to have a reduced amount of blood supply which is going to the right ventricle. And that's bad because that can lead to supine hypotension syndrome, a group of featured many disorders. So very, very important that that is noticed. At least if at all we are to support these women, if they want to lie, at least they can lie in the lateral position, because that will increase blood flow to the heart. So another thing to consider, as well as that, we are going to consider the changes in the GI tract. So in the GI tract, we are going to have the stomach being compressed also as a result of the growing uterus. So when the stomach is compressed, then even the lower sphincter muscle, the esophageal sphincter muscle, is going to dilate. And once the lower esophageal sphincter muscle dilates, that simply means we are going to have a reflux. And a reflux being regurgitation of food, we are going to have a backward going of the stomach contents instead of going in the stomach contents. And as well as that, there's going to be reduced motility of the GIT. The GIT is going to reduce in motility, that's movement. And when the GIT is reduced in motility, then that simply means we are going to have a flow of food going into the stomach. And when that happens, then even the food will be going backwards. There's going to be the reflux. So that means we are going to have a heartburn. So as a result of the growing fetus. And as well as that, as a result of progesterone, lowering directing the muscles of the maternal changes, and that's going to reduce blood pressure, and also the muscles are going to be relaxed. And once those muscles are relaxed, it's going to be reduced motility. So the woman can have a lot of changes. For example, hyperemesis gravidarum, that's vomiting in pregnancy as a result of the sphincter muscle, the esophageal sphincter muscle being weakened by progesterone. And as well as that, so having talked about the GIT, it's also important to note that the stomach contents will also increase, will reduce. So having talked about the GIT, we are now going to talk about the kidneys. So the kidneys are going to enlarge. There's going to be hypertrophy in the kidneys. And when that happens, and the increase is because mainly due to the increased vascularization, because there's going to be an increase in blood in a maternal pregnancy because of this thing. We want to support, of course, this with a lot of things. So the mother is supporting the she's supposed to support our life, also the life of the growing fetus. So she's supposed to have an increase in blood supply, so about 500 mils to 700 mils. And because estrogen causes because estrogen, it's gonna cause fluid retention. That simply means we're going to have a lot of fluid in the intravascular compartments. So that simply means we have a lot of fluids also going to the kidneys. And the kidneys are supposed to do their job by excreting everything that is in the blood that is not supposed to be used, such as urea, bicarbonates, and all sorts of things. And when there is an increase in the intravascular compartment, then that simply means the kidneys needs to work even more, even harder and harder. So that is also going to be done by this increase in blood in the mother's circulatory system. And as well as that, there's going to be pressure in the bladder as a result of the growing fetus. So the kidneys will increase their secretions also, excretion. So the contents which are supposed to, there will be micturition. Micturition is a frequent urinating as a result of the bladder being compressed by the growing fetus. So it's going to be hard for the woman to keep the contents in the bladder as a result of the growing fetus. So very, very important to notice. In the next talk, we are going to talk about the physiological changes of pregnancy, of course, mainly on the reproductive system. And that's good because we have learned a very good background of the understanding of the next topic because of what we have covered a lot.